Across the nation, measles becoming a rising concern for communities, and that's now the case here in Oakland County, where the first case of measles in the state of Michigan was recently confirmed, both by the Michigan Department of Health and Human Services, as well as the Oakland County Health Division, with the cases being confirmed in the Rochester area in the last week or so. Christie Clement-Halladay is the chief of the Oakland County Communicable Disease Unit with the Oakland County Health Division and joins us for more information now on the Splash Live. Thank you so much for being with us. Appreciate it.
Of course. Happy to be here.
Yeah, happy to have you on to talk about this because it's something that we're hearing in the national news. We're hearing a lot about the measles. It hasn't quite hit our community until recently, where we had that first confirmed case in the state of Michigan in our local area. So when it comes to the measles, what are the primary concerns from our local health apparatus?
Our primary concerns are that we really want the community to check their vaccination status, for one. Basically, anyone, if you were born before 1957, are considered to be immune because measles was so common back then that everyone was pretty much infected or at least exposed. If you were born after 1957, we really recommend you check your immunization status. If you have 2 documented doses of the measles, mumps, and rubella vaccine, then you're fine. If you don't have 2 documented doses, our recommendation is to go ahead and get vaccinated through your own healthcare provider, or we do offer the vaccine here at the Oakland County Health Division at both our Pontiac and Southfield locations.
And we know that the confirmed case in our local area happened just recently, just in the past several days, and it was in northern Oakland County. And so for those that may have been in that general area, first of all, tell us where that area is and what people really should be on the lookout for symptom-wise in themselves and others, if they may have been around that exposure site.
Yes, absolutely. So through case investigation, we determined that the person with measles, while they were contagious, had dinner at Cruz and Muir on the main street in downtown Rochester, and that was on March 3rd. And then also made 2 trips to the emergency department at the Henry Ford Emergency Department in Rochester, also known as Crittenton. So if anybody was at those locations on those days, they should, first of all, check your vaccination status, make sure you're up to date. And secondly, just keep an eye on your symptoms. Measles has an incubation period of anywhere from a week to 3 weeks, 7 to 21 days. And look out for symptoms. The hallmark symptoms that we're looking for are kind of like cold-like symptoms: runny nose, cough, red, runny eyes, followed by a high fever and a rash. Generally, the rash starts on the head and works its way down the body, and that will happen after the cold-like symptoms. So keep an eye out for those. If you do experience any symptoms you're concerned about, call your healthcare provider before going in so that you can alert them that you're concerned you may have been exposed to measles and you may have some symptoms that are consistent with measles. Always call ahead.
The recent exposure, the first case of measles confirmed in Oakland County since July, and in the state of Michigan since July of 2024. So just a little under a year later, we have this case confirmed here in the state of Michigan, the first and the most recent, for lack of better terms off the top of my head, outbreak across the United States. But it's also not quite at the point where there's a cause for panic in the health community. And so where does the health community stand at this point, both in our local area, but even beyond that at the state and the national level when it comes to these most recent cases we've been hearing about?
Yeah, absolutely. There's no cause for panic. We don't want people to panic. We want them to be aware. Certainly, we're concerned. Anytime there's a resurgence of a vaccine-preventable disease, it's cause for concern. But it is a vaccine-preventable disease. It's highly preventable. So we want people to be aware, check their vaccine status, and make sure they're up to date and their children are up to date in vaccine. Because we can definitely prevent an outbreak in our area. We just need to be aware and take precautions.
Oakgov.com/health is the website for the Oakland County Health Division. Christie Clement-Halladay joins us today on the Splash Live. She is the chief of their Communicable Disease Unit. As we talk about the measles cases that have been noticed of late across the nation, the first confirmed case in the state of Michigan, right here in Oakland County at the beginning of March in the city of Rochester. Getting the information out there, what you need to know about measles as it affects Oakland County and our local area here in in Greater West Bloomfield at this time. And Christie, it's not lost on me, and I'm sure it's not lost on many people, that this is coming out on the 5-year anniversary of really when we got to the beginning of the pandemic stage of the COVID-19 saga. And so now that we've got that information behind us, we've gone through that experience, our health community has gone through that experience, how have those lessons informed the way that Oakland County and our local health systems are approaching things like the measles, that is, as you said, a disease that does have a vaccine cure to it?
Yeah, sure. That's a great question. We want the community to know that we are their partners here at the health department. We want to be completely transparent as much as we can be. We want to build trust. We want you to know that we're here for the health of the community. What's different about a measles outbreak and early COVID days is that we know measles really well, right? We know what to do. We know what interventions to put in place to halt spread of disease. And we're confident in that. And so we really hope that the community reaches out to us with questions, concerns, and has trust in us. And we can do everything we can. It's feasible to prevent the spread of measles in our state if we take that action.
And it's inevitable that there are going to be some people that are averse to getting updates to their vaccinations. They want to take other methods to keep themselves healthy and safe. And especially now as the weather is starting to warm, people are starting to emerge from their homes. How much more important does it then become to take those additional basic steps that we did learn during the pandemic that may not involve necessarily vaccines to also help prevent the spread of measles potentially in Oakland County?
Yeah, absolutely. It is always important to keep a healthy diet, get adequate sleep, exercise, reduce stress as much as possible. That helps us overall in our health maintenance for all kinds of illnesses, whether they're chronic illnesses or contagious diseases, helps improves outcomes. So we definitely want to make sure that people are aware of just their health status and health practices as much as they can be. And just be aware of symptoms to look out for. Again, even if someone's not vaccinated and they are having symptoms they think are consistent with a communicable disease such as measles, reach out to the healthcare provider. You can even call us at the health department, and we'll provide resources and talk you through that. But certainly now that the weather's getting nicer, we're a little bit more cheerful and able to get out there. So get some exercise in, walk around, eat some healthy, fresh foods, and get good rest.
More information and contact info for the Oakland County Health Division if you have additional questions can be found on oakgov.com/health. Christie Clement-Halladay is with us on the Splash Live today as we talk about the most recent exposure of measles in Oakland County and Rochester in early March. Now, the concern date is in early March. Those on or after March 10th that may have been exposed to measles in our community. And really the symptoms start to appear for about 3 weeks after that first exposure. And there is a certain amount of time where the most effective treatment for high-risk individuals may be in play. So if people are watching out for these symptoms, they may have been in that general area in Rochester during the time of exposure. How long should they be watching out for those symptoms, and how important is it to get help early on if they do experience them?
Yeah, it's always important to get medical care early on. So measles has an incubation period, meaning the time from when one is infected to when they experience symptoms of around 7 to 14 days, but at the long end, it can be up to 3 weeks or 21 days. So we just really encourage anyone who is experiencing any symptoms that they think might be consistent with measles. So like I said, it starts out with a runny nose, cough, and a lot of times red runny eyes, like a pink eye type of situation. Followed by a fever and then a rash that starts on the head and works its way down. Call your healthcare provider right away. Anytime there's an infection or a healthcare problem, the earlier that you get medical intervention, the better. Now, there's no specific treatment for measles. It's generally just supportive care in terms of symptoms and complications that can show up. So we definitely want to make sure a healthcare provider is involved because measles can cause pneumonia, ear infections, rarely brain swelling, and several other serious complications.
And lastly, Christie, just briefly, we've got about 30 seconds. I know that
Sure.
in some cases with these communicable diseases, it's better to call an emergency department at a local hospital as opposed to going into your doctor's office. Is that the case with this, or can we go to our primary care provider?
You can absolutely go to your primary provider as long as you're not feeling like it's a life-threatening situation. And we encourage the healthcare providers in the community to reach out to us. So if a patient calls with concerns about measles, we can provide direction on how to safely obtain lab tests to determine if the person has measles or not without putting the medical care staff or other patients at risk.
All right, well, we appreciate your time and appreciate your insight on this. Again, just one case so far that's been determined in Oakland County, but any case of measles is something that we have as a vaccine-preventable disease that's reemerging, as you have said, something to at least keep your eye out for those symptoms. And if you're feeling unwell, to go get checked out. Christie, thank you so much for your time.
Thank you very much.